When learning about the lymphatics, it's often easy to get weighed down with all the detail of where the system goes, what body part drains into what. But we're going to keep this very osteopathically focused and show you exactly what you need to know in order to get the question correct. There's a simple flow that you have to follow for every single patient, every single time. So if you have a lymphatic question, go through this flow every single time, and you'll get the question correct every single time. So to start off with, how does the lymph normally move throughout the lymphatic system? There are two big forces that help push the lymph throughout the lymphatic system. You can have smooth muscle contraction and compression. So imagine that you have fluid stasis in your lower extremities. When you're walking around, you're compressing the vessels in your lower extremities, and that's forcing the fluid to go back up throughout the rest of the system. When you're thinking about smooth muscle, imagine something is being squeezed at one end, and it's forcing everything else in the same direction. That's the idea of what normal motion is. So what are you going to see in a patient who has some sort of abnormal motion? Oftentimes you're going to see some sort of fluid stasis. If you see a patient who has some sort of fluid stasis, you may want to consider treating the lymphatic system. Another patient that you might want to treat is one who has a mild infection. We're going to loop back around to mild infection at the end of the lecture. So what about some contraindications for treating the lymphatics? The main contraindications that you need to think about are fractures, cancer, mainly metastatic cancer, and severe infection. The general idea is that if a patient has one of these three things, you don't want to make the condition any worse by spreading it around by doing some sort of lymphatic technique. So what's the formula that I need to know in order to get these questions correct? So let's imagine that the waves of water represent some sort of fluid stasis somewhere in the body. The idea is that it gets stuck because of a choke point. The choke point is simply some sort of clog or choke in the lymphatic system. That choke makes it so that the rest of the lymphatic fluid cannot flow through that area, thus creating the choke point. There are numerous choke points throughout the body. And there are really 5 major ones that we're going to talk about. So why do these choke points even matter? The whole formula is that you have to treat the choke points in a certain order. You always follow the order no matter what. You always start in one place, you end up in the last place. Never skip around in the order. So what are these choke points? The first one that you always want to treat first is a thoracic outlet. So theoretically, there can be many different things that cause a thoracic outlet choke point. Anything in the area can really do it. But 2 common ones that you can see are clavicle dysfunctions in ribs 1 and 2. If you have some sort of dysfunction in one of these two structures, then you may have a thoracic outlet choke. So how do you treat it? We've already talked about how you can treat these in previous lectures. So clavicle, you can treat the AC or the SC joint. And ribs 1 and 2, you can treat using an inhalation or exhalation treatment. The next choke point is going to be the diaphragm or the axilla. So what structure will cause a choke point at the diaphragm? The diaphragm. So when you're treating the diaphragm, how are you going to do it? You can dome the diaphragm. You can treat the attachment points at ribs 6 through 12. Attachment points is L1 through L3, and the xiphoid. We already talked about how you can treat ribs 6 through 12 and how you can treat L1 through L3, but we haven't talked about doming the diaphragm or the xiphoid. Just apply some of the concepts that you learned earlier in the lecture series. If you do a direct myofascial technique to the diaphragm, you can insert your fingers under the rib cage and push it where it does not want to go into the restricted barrier. And the opposite for an indirect technique, push it into the freedom. So this is how you would treat the diaphragm. But what about the axilla? Just like for the thoracic outlet, anything that's up in the axillary region can cause a choke point in the area. But one common cause is pec minor. So if you want to assess the axilla for a choke point, assess pec minor. And if you want to treat it, apply some techniques that you learned earlier. You can either use muscle energy, you can use myofascial, whatever you feel like doing. The next choke point is going to be the hip. And what are some common dysfunctions that cause a hip choke point? You can have the psoas, the quads, and the innominants. We've talked about how to treat these three structures in earlier lectures. If you are assessing for some sort of a hip choke point, check these three structures, and if they're dysfunctional, treat it, and you'll treat the choke point. The next one down the list is going to be the posterior knee. So what can cause a choke point here? Think about some structures that attach to the posterior knee, like the hamstrings, and the gastroc. If you want to treat the posterior knee, you can do it any way that you want to. You can do a direct myofascial technique and release the structures into the barrier, or you can push them into the freedom for an indirect technique. Muscle energy, engage the barrier, so on and so forth. Now what about the final choke point? The final choke point is going to be whatever the distal dysfunction is. And how are you going to treat it? You treat whatever the dysfunction is. So no matter what the dysfunction is, if you're treating the lymphatic system, you always have to follow the flow. You always start at the thoracic outlet. Then you move to the diaphragm or axilla. Then you move to the hip. Then you move to the posterior knee. And then you do the distal dysfunction. The only time that this changes is when you are assessing the thoracic outlet and they do not have a dysfunction in that area, you can skip it. You can't treat something that's not there. But if you skip it, you have to go to the next choke point down the list. So you have to go to the diaphragm or the axilla. Then you have to go to the hip. So what about diaphragm or axilla? If it's an upper extremity lymphatic issue, and you're trying to treat the upper extremity, there's no real reason that you need to be treating the hip and the posterior knee. So you can treat the thoracic outlet, then go to the axilla, and then perform a pump technique. So once that you've released all of the choke points in the very specific order that you have to go through every single time, you can then finish the treatment using a pump. There are a few different pumps that you can use in different situations. You have the pedal pump, which is also known as the Dalrymple pump. You can use the thoracic pump, which is also known as the Miller pump, or you can use extremity milking. So why would I use a different pump depending on which portion of the body that I'm in? If you follow the example and the distal dysfunction is somewhere in the lower extremity, you'll want to do a pedal pump. Lower extremity, use the feet. And remember, this is the treatment where the patient is lying on their back, they have their feet out, and the doctor will push the feet forward quickly to get the fluid moving. If the lymphatic treatment that you are wanting to do is in the thoracic region, then you do the thoracic pump. If it's in the upper extremity, you can do extremity milking, where you just squeeze the upper arm to push the fluid in the direction. So now we're going to loop back to mild infections. If you have a patient who comes in with some sort of a common cold and you need to help move around some of the fluid in the sinuses, you can just do a facial sinus pump or effleurage. One treatment for otitis media would be the gall breath maneuver. And remember, this is the technique where the physician grabs the angle of the mandible and pulls forward to help open up the eustachian tube and get fluid moving. So in this lecture, we went over the order that you have to treat the lymphatic system in. No matter what the dysfunction is, you have to start at the thoracic outlet. If there is no dysfunction at the thoracic outlet, you can then move on to the next choke point down the list, which will be the diaphragm. No dysfunction, move down the list to the hip. No matter where it is, go through the list in the exact order, and then finish off your technique with one of the pumps. And that's OMM for lymphatics.